Do you know that stage 1, 2 and 3 breast cancers are completely curable? Whereas stage 4 breast cancer, we cannot achieve a cure. We can just control it. Hi, I'm Dr. Rohan Khandelwal. I'm the Principal Consultant and Head of Department of Breast Surgery at CK Birla Hospital, Gurgaon. Breast cancer is now becoming the most common cancer amongst Indian women. Absolutely. If breast cancer is picked up at the right stage, it is completely curable. And that is why it's important to know the stages of breast cancer. Now, like I said, stage 1, 2 and 3 breast cancers are completely curable. Whereas stage 4 breast cancer, which is spread to the body, we can just control the disease. We cannot achieve cure. Which is why it is important to know the stages of breast cancer and to detect breast cancer early. So there are 4 stages of breast cancer. Stage 1 is when the breast cancer is only limited to the breast and it does not spread anywhere else. Stage 2 is when the breast cancer involves the breast and the underarm lymph nodes. These lymph nodes act as the first barrier of defense from the body where the cancer can go and the body tries to stop it there. So if the cancer is spread to the underarm lymph nodes or the axillary lymph nodes, we call it a stage 2 breast cancer. Stage 3 breast cancer is when the skin is involved or if the underlying chest wall muscles are involved. That makes it a stage 3 cancer, or if the size of the cancer is more than 5 centimeters and the lymph nodes are also involved. Stage 4 is unfortunately when the cancer spreads to the rest of the body. So some ladies come to us with late stage breast cancer. And how do we know clinically that the cancer has spread to other parts of the body? Well, if a breast cancer patient is complaining of bone pain, or the patient is having headache, has had seizures, or has difficulty in vision, or they have chronic cough which is there, all these are indicators that the cancer might have spread to other organs. Some patients can even develop jaundice or yellowing of the eye, which suggests that the cancer has spread to the liver. Now, breast cancer most commonly spreads to the bones, which is why most of the patients would complain of back pain or leg pain. The most common bones which are affected are the bones of the spinal column or the vertebrae, and the patient can come to us with back pain. Now, how do we figure out whether the cancer has spread? So like I said, we carry out a PET CT or a bone scan. These scans help us in detecting whether the cancer is localized or has it spread. If the cancer has spread to the bones or other organs, it is a stage 4 breast cancer where the intent of treatment is not curative. I cannot completely eliminate it from the body. We can just control it and make it sleep for prolonged intervals. That is why it is important that breast cancer is picked up early, and if the patient is picked up at an early stage, the survival is better and the treatment required is also less. Now, to know the stages of breast cancer, we carry out a clinical examination. We will do a test which is known as a PET CT, which is a whole body scan, which can tell us whether the cancer is just localized to the breast or has it spread to the other parts of the body as well. Now, in majority of the cases of stage 1 and 2 breast cancer, we carry out surgery first, and then the patient might require chemotherapy or radiotherapy. There is another modality of treatment which is hormonal therapy. But in stage 3 breast cancer, chemotherapy is done first. So in stage 3, we do chemotherapy first. We try to shrink the tumor. This is known as neoadjuvant chemotherapy. And once we've done that, then we carry out the surgery and the radiotherapy. So for stage 1 and stage 2, usually it's surgery first, whereas for stage 3 breast cancer, we carry out chemotherapy first. For stage 4 breast cancer, I told you it is not curable. It can just be controlled. And the first line of treatment there is usually hormonal therapy in the form of tablets or chemotherapy. Surgery has limited role in stage 4 breast cancer. So this is how we manage the various stages of breast cancer. If you have any further queries regarding these points, please do drop us a comment and we'll be happy to help you out. Thank you.